Having put the nation on a war footing, Scott Morrison headed to his own Western Front.
Prime Minister.
A Liberal wasteland after Labor's barnstorming state election victory last month.
They have rewarded the strong leadership of Premier McGowan.
The Prime Minister wanting to conscript the WA Premier and other state and territory leaders to a twice-a-week national cabinet to speed up the vaccine rollout.
You've got to be practical, you've got to work together, you've got to solve problems.
Under Scott Morrison, we'll meet them on the beaches, we'll meet them on the phone hookups. That's his idea of war footing.
The Premier's a bit more charitable.
I'm relieved that there is now seems to be a sense of urgency, but I do also urge the federal government to continue to share information with us.
I would have anticipated we would have needed to meet more often as we got in more supply, but happy to go along with whatever the Prime Minister requests.
The locally made AstraZeneca vaccines no longer recommended for those under 50, and the overseas supply of the Pfizer alternative is tight. But the Prime Minister now favours establishing a mass vaccination program to catch up.
Firstly, in the instance of those aged between 50 and 70.
Melbourne's Royal Exhibition building's already been put to use, as it was during the last pandemic a century ago. And other cities around Australia have also set up central vaccine hubs. But with the vast bulk of Pfizer doses not expected to arrive until later in the year, Australians under 50 will have to wait until closer to Christmas to get their jabs.
But that will only be possible if we can ensure that we have the max vaccination program in place that can do that in that space of that final quarter.
Though Scott Morrison's being careful not to commit to any new targets, when he meets premiers on Monday, they'll receive vaccination scenarios from health officials. One will involve ramping up AstraZeneca jabs for the over 50s from June, then distributing the bulk of the Pfizer doses for the under 50s from October. Only the states can organise mass vaccination, so if things go wrong, blame would be widely shared. Andrew Probyn, ABC News, Canberra.